Telehealth research presentation. Our topic was on a electronic health record barcode scanning system.
We created the EHR barcode. We would use it to update and print the barcode and attach the barcode to something you always carry with you. This could be a license or a health insurance card. Anytime you seek healthcare, the healthcare professional will scan you in and update your visit after. Once you enter the emergency room, they'll scan you in and transfer your medical records to the secretary and the physician you'll see. You can print the barcode yourself and stick it to an accessible card, or choose to just have it imprinted on your license by the DMV. It cuts down on paperwork in the emergency room as well as wait time. It's a convenient way to access your EHRs on your own as well. In emergency situations, medical personnel can scan the barcode and identify someone as well as be informed of any past medical conditions. Also, you can use it and access it on your smartphone if you have one. Those with smartphones can use the QR barcode to update their medical records onto their phones, which they can keep with them at all times. If you don't have a smartphone, you can have a login and password to use on a website page. They're not essential, but will cut down on wait time and make things run more smoothly for those who have one.
So we did research on this topic, and we used a systematic review to find current and relevant sources on electronic health records. And research shows that the presence of an electronic health record in emergency room settings improves accuracy of diagnoses and also reduces mortality. But the presence of any type of electronic health record or health information exchange system is currently relatively rare in hospitals today. And the success depends on the willingness of doctors and insurance companies to implement new technologies, and also more expensive or complicated health information exchange systems are less likely to be implemented. And our product fits into this because it provides an electronic health record to improve the accuracy of diagnoses and will shorten waiting time in the emergency room, and therefore it will also hopefully help reduce mortality rates and provide accurate patient history. And it's also a relatively simple system for emergency room staff and doctors to learn and use. And the barcode system is also relatively inexpensive compared to other extensive electronic methods.
So for our development evaluations, we had three large concerns and criticisms that we had to address, and these were practicality, identity theft or identity issues, and affordability. For the practicality criticism, we thought that its value and practicality is extremely high and has potential to create large savings in time and resources. For the identity theft, identity issues, scenario would be someone takes a card and tries to use it to get benefits. The way that this could be solved is when you scan into a system, a photo identification pops up. If it's an electronic system, passwords or personal questions will be asked. And affordability, after the technology receives funding, becomes successful, then it can be implemented in Medicare and Medicaid programs to help lower income individuals pay for the technology. The system evaluation, once the technology actually gets up to speed and is starting to be implemented, we'll evaluate the program at 6-month increments by a formal review board for the first year, and then annually in the years after that. We will conduct a trial period in which 2 test groups are observed, one using the technology and the other group not using technology. And at the conclusion of this test, we will see the average wait times and the efficiency of the system when used in medical settings. We can evaluate our system by recording the waiting time for emergency room waiting time, prescriptions, other medical services, before the implementation of the system as compared to the waiting time 6 months after the system has been implemented. The wait time for the cases of a similar severity will also be compared. An example of an update for a review board would be this graph. This would be an example format of the layout. The time spent waiting would be in months, and the months after implementation are seen there. An example curve. Without technology would be in the purple. You could see maybe wait time hasn't changed, but with the technology, the waiting time will decrease over time, hopefully speaking to the efficiency of the system.
Funding will allow us to fully develop the product. With proper funding and the use of proper engineers, we can build both an effective internet database and also the necessary machinery to make and read the barcodes. Once the tools are developed, we may test the system by placing it in a few hospitals and analyzing its effectiveness. Once it is done, we can look for kinks and work to improve the system before its implementation. We can then distribute our tested product to hospitals in order for them to have the ability to scan the patient's barcode and maneuver the online system. Funding will also provide a means of informing the public about this product and of its potential benefits to their health. With this exposure, it will become a normal part of every individual's hospital visit. Doctors and nurses will be trained on how to scan barcodes and how to maneuver the online system in order to obtain the best information. The public will be taught how to input their information into the system and what procedure to follow when using their barcode in a medical setting. Once the system is in place, continuous funding will allow the use of software to continue. Upkeep and repairs will take place as needed. Funding will allow for the development of the online database, which will store all essential medical information for each individual. It will also allow for the development and engineering of the specific barcode and the barcode scanner needed to access the information once it is submitted. The possible issue of privacy infringement may be corrected with proper funding. Development of a barcode scanner, which is only available in healthcare settings, for example the ER, and therefore is the only way of accessing the information.
With regards to product development costs, we'll create a non-working prototype using Axer System, which is a wireframe software that will show a mock-up of how the product, website, and phone apps will look, and that would be about $10,000. And we'll create an initial database with basic functionality with easy security, so not a secure login and things such as that, and that would be about $25,000. And developing the production application, that'll have databases of the patient information, security systems, individual logins, phone automated support systems, licensing, insurance. It'll have various tabs for medication, allergies, medical history, and it'll have backup systems, and that'll be anywhere between $200,000 and $300,000. With regards to personnel, each training session will be about $3,000. And the product review committee board salary will be around $70,000, and distributing to hospitals of the software will be around $40,000.
For a possible spin-off of this product, this kind of development may eventually lead to more governmental involvement and the funding for this technology. In the future, it may be possible for a government-mandated barcode to be automatically printed on licenses of every citizen. With time and success, the product could become the norm of every U.S. citizen in all healthcare settings.
In summary, the goal of this product is to maximize efficiency and ultimately minimize wait time in emergency rooms by having patient medical history and records easily accessible. As long as the patient has either a barcode or access to his or her account through the internet, medical information regarding patient history, allergies, and medication will be readily available to both doctors and nurses. Nurses will be able to update information that could then be viewed by the physician just moments later. Physicians will then be able to spend more time treating patients and less time collecting patient medical history. Our initial target population will be those who use the emergency room in a frequent manner and have an extensive medical history, such as elders and the chronically ill. The progress of the program will be evaluated at 6 months increments for the first year and annually for 2 years after that. And at the time of evaluation, all kinks in the program that may arise will be adjusted. The hope is that with time, this product will be available to all individuals nationwide. And here are our references. Here's our prototype of our application, and this is a standardized license. And on the back will be a barcode, and we could also use it on a iPhone or Androids, Blackberries, etc.
Thank you for watching.